Hey, hello, everyone, again. Welcome to this month's Edi and Neal's Book Club webinar, which features guidance from library leaders in small public library management and on library programming for autistic children and teens. This is a two-part webinar that will run approximately 60 to 75 minutes, inclusive of audience Q&A sessions after each presentation. A recording of the webinar will be available on the main ALA YouTube page later today. If you like what you hear from the presenting authors, I encourage you to buy their books directly through our website at alastore.ala.org or your preferred vendor. Email Editions Marketing at ala.org for bulk sale discount queries. To join or renew your ALA membership for additional discounts on their books. To check the ALA e-learning database for longer continuing education programs on related topics. And finally, to sign up for the upcoming Recharging and Challenging Times conference in February from ALA, the PLA conference in April, and the ALA annual conference in Chicago this June, so that you can engage with other brilliant thought leaders in the ALA community in person. Meanwhile, let's get started with our first presentation. We have for that Cindy Fesemyer and Christina Jones, who are the authors of the new Small Public Library Management Second Edition. Welcome, Cindy and Christina.
Thank you. Thanks for having us. Okay, so everyone's seeing my first slide, right? The title of the book?
Looks good.
Yeah, terrific. Thank you. Let's see. Go for it, Christina.
Okay, we'll just get started with introducing ourselves to you and telling you who we are. So my name is Christina Jones. Along with Cindy, I am the co-author of the second edition of Small Public Library Management. Currently, I'm on the library board of the Monona Public Library in Wisconsin. And previously, I worked as a community engagement librarian at Madison Public Library. And before that, I was the director of the Altoona Public Library in Northwest Wisconsin.
And I'm Cindy Fesemyer. I'd say the majority of my experience that informed this second edition of the book with Christina was the 7 years that I served as the library director in Columbus, Wisconsin. So a smaller, more rural area that probably a lot of you are familiar with serving. I also was on the I worked at the state library here in Wisconsin for about 3 years as their adult and community services consultant. I've taught academic and continuing education courses for my library school, the University of Wisconsin-Madison iSchool, and I served on the board at Madison Public Library for 8 years. Yeah, that's me. So before we really jump in, we just wanted to sort of reiterate our thanks, which we mentioned in the book, to the folks who got us here today. The first edition was written by Jane Perlmutter and Paul Nelson, and both Christina and I, when we were in library school together, took classes from Jane and Paul, and we're just thrilled to have been able to pick up the mantle. And a big shout out to Meredith Lowe, who was the original person that I was working with on this book, and she really got us off to a great start before Christina stepped in to finish it all up.
So those of you who work in small libraries know, and any size library, that small public library directors wear many, many hats. So our book covers a wide range of topics, which you can see here. These are all the chapters in the book. Everything from building your collection to facilities management, managing staff, to strategic planning, and more is in the book in kind of small, easy to reference, bite-sized pieces.
And I'll just mention that we don't get into super huge detail on really any of these topics. It's meant to be a broad overview of what it is to manage a smaller library. For example, our next presenter will be getting in depth on some specifics with programming in your library. So today, based on what we've been hearing as feedback from folks who've seen the book or sessions that we've presented about the book, we're going to be focusing on 4 things. That is facilities, customer service, working with stakeholders, and strategic planning. So I'm going to kick us off with facilities, and you're going to get a little bit of storytelling from Christina and I. So I'm going to start with my initial story in Columbus, Wisconsin. I should let you know that Columbus was about a half hour northeast of where I lived in Madison, and I did not relocate to Columbus. I drove back and forth every day. So I was the quintessential outsider when I started there. I believe that I was hired by the board because they had a beautiful but very much too small Carnegie Library. And so either an expansion or a new facility was sort of meant to be my main focus, I think, as the director, along with everything else. But I quickly learned that change is hard for staff members, for library board members, for the community as a whole. And it was clear that there were a lot of steps that needed to be set up before I got anywhere close to working with an expansion. So with facilities specifically, I really just sort of lived in the library for the first year to see how the spaces worked, how they might be changed with what we actually and had to make the concerted decision along with the staff to either one, let the library show how it was much, much, much too small by having overflowing stacks and letting books stack up on the ends of bookends and really just sort of proving that there wasn't enough room. Or two, working with what we had and making it as beautiful and user-friendly as possible. And we opted for that second one. We didn't want the library to be sort of a chaotic mess just to prove a point. We wanted it to serve the library or the community in the best way possible. So one of the first places I turned my attention was, along with the library staff there, was the youth services department. And in the children's library, it was very crowded. So we had to do a little bit of like weeding, not just of the materials, but of what was happening in the spaces. It was clear that there was a level of shabbiness throughout the library, but it was super clear in the children's library because kids are hard on their libraries. So specifically, I noticed right off the bat that the board books were disgusting. They were clearly chewed and like warped with water and falling apart. And it was clear that we needed to do, just based on the way the books looked, needed to do a big weeding. And that was actually the first kind of bigger project that I did. It felt like a big project as a new library director. And I decimated our board book collection, weeding over half of the books before ordering new titles to refill them. So it looked like I was just getting rid of books. And I will say the reason it says don't mess with the homeschool moms is 2 or 3 homeschool moms within the first week of me being there and weeding the board book section took me aside and had a stern talking to with me about how important board books were in the development of their children. And I assured them that there were books coming, but lesson learned a little bit. If you're going to weed extensively, have some books ready to backfill if necessary. The same kind of thing happened with the train table. You know, lots of libraries have Lego tables, activity tables, whatever. Ours was a train table, and it was so grubby and just clearly well loved. It was clear it needed to be replaced. And as I started making noise about that, figuring out how we were going to afford to replace it, again, some homeschool moms took me aside and were like, "Oh my gosh, you can't take this away. My kids love it. It's so important. It's a big part of what we do." And so what I did was I worked with them to develop our approach to replacing it, and we replaced it with a like multi-top PlayStation that would have the train table sometimes. Sometimes it had a Lego top, and sometimes it had more of a like STEM science top that we did. And so I did that in association with those mothers. Now, on the path of trying to build an expansion or a whole new library in general, The library itself was located next to an empty lot that used to have a house on it, but the house was relocated and they used that lot for programming, which was great. But they had another lot that had plenty of space. So we turned that empty lot into a parking lot. The library had no off-street parking. It was only street parking. And we had a lot of disabled folks coming in and lots of people with little kids with strollers and that kind of thing. So for safety purely, we needed a parking lot. And that was the first thing that I had to convince the board that we should spend that money. I had to convince the city that we should spend that money. And that was the first really big splashy change that we made. But that didn't happen until probably about 3 years into my 7-year tenure. So I had been moving kind of slowly with the pace of change that the community could handle, because it was clear from my initial kind of missteps that I needed to move at the pace of the community, not at my brand new director. I'm so excited. Let's change everything pace. So things moved slowly. By the time I hit my 6th year, it was the library, then the empty lot that became the parking lot, and then one more house over here. That house came up for sale. And I had done enough relationship building out in the community that I was able to find an anonymous donor to pay for half of the cost of that house. The stipulation on that was that they required that the city pay the second half, which was really smart because they wanted the city to have a stake in this extra house that would either become part of the library as a standalone or be ultimately knocked down so the library could create a new facility in place. That did go forward. The city took a little bit of convincing, but bringing that much money to the table really helped them realize that there was like movement in the community to make the library be much bigger than it had been. It was well undersized, and I had data to prove that. So when I left as the library director there after my years, that second building we called the library annex. It was not staffed because I didn't have the money to staff it, but it housed a very big Friends of the Library like bookstore that they opened on the weekends. And I invited area organizations to have a place in it. So the local historical society had a display of some of their holdings, and nonprofits were able to use this space. It had a non-accessible second story, and I was big into the arts, so I rented for a very cheap price to local artists so they could have studio space. So in exchange for their low rent, they just needed to either do a project at the library now and then, or a program at the library every now and then, or to participate in a public art project. So we were able to sort of make the arts front and center through that Columbus Public Library Annex. So you can see that really the theme of my experiences with facilities and the theme throughout what Christina and I are going to talk today is change. And it's moving at the pace that the people you serve can bear. So for me, I needed to slow my roll. Let's go to Christina.
Yeah, so I'm going to talk a little bit about customer service. And in the context of customer service and managing change, I'm really going to be talking about a change in customer service culture among staff and patrons. So I have found that sometimes customer service in libraries can become a little less patron focused than we want. The focus can start to come more on protecting library resources rather than expanding access to them, or more about getting everything we need to do done than focusing on the person in front of us. And I think there's very real and challenging and legitimate reasons for why this happens sometimes. But that said, attempting to shift the change and the culture can help. So when I came in at a library I was working at, I started by leading by example. So as the director, I put myself at public service desks and provided the types of customer service that I wanted to see and that I would want to experience as a patron. I remember one time working with a patron who was unhappy about something, and we kind of worked through it. We eventually got to a place where it was resolved as well as it could be, and we both ended the conversation smiling. And a staff member who'd been at the library for a long time kind of looked at me after she left and said, "How did you do that?" And we talked about it, and I realized that, maybe sometimes it's not like a lack of desire to provide a certain type of like customer service or attitude or approachability, but also just a lack of maybe knowing how and practice. So I focused on providing training about customer service, providing opportunities to practice. We talked about different elements of customer service at staff meetings, and if they were helpful, online training, um, and um, any really, and on any topic, I would provide space like in my office where they wouldn't be interrupted and time for staff to complete those trainings. Another example is that in looking at our policies and values, we made some changes when it came to privacy, which did cause some issues with customer satisfaction. We'd been pretty loose when it came to letting people pick up other people's holds and things like that. And to protect everyone's privacy, I wanted to rein that in. Customers weren't always happy about it, and it wasn't always easy for staff to enforce. But this was something that was really important to me as believing in the like our values of libraries and privacy, and people feeling free to kind of like check out what they need, in like without in a confidential way. So I tried to set staff up for success by providing prompts they could repeat about why we were doing it, making sure they understood the reasoning, and friendly kind of alternatives to suggest. And especially in a small town, it can be hard to be consistent with privacy boundaries. Everybody knows each other, you know them, they know you, we're all friendly. But it was important for me to do this. So we worked on it. People got used to it, and after a while, it just wasn't a thing. And I think there's always some element in workplaces of we've always done it this way, which can be hard to get over. And it is, I think, important to remember that it's not always just library staff that can feel that way, but patrons too. Like patrons, like you've always done this for me. Um, and for the change to be successful, it can take a lot of time and patience, and like kind of just knowing it's going to be a thing for a little while, and understanding that people are going to be a little upset at first, and trying to reiterate the real reason and values behind what you're doing, why you're doing what you're doing. I'll move in also to working with stakeholders. So here I'm talking about stakeholders in the context of like your city council, town board, city staff, other municipal heads or town boards, that kind of thing. And as a new public library director, it's very possible you can come into a situation where relationships between the library and the municipality can be strained, creating a situation where you might want to change that relationship. I came into a situation that was a little bit like that when I started as a director, and the first thing I really did was take time to observe the dynamics and get to know people on the city staff and leadership. I stayed out of any chatter, I just kind of listened to like what the dynamics were and what was going on. I also set up meetings with each city council member to meet with them, introduce myself, hear about their visions for the city, tell them about the library and myself. And there were certain issues that seemed to really bother library staff about how the city did things and vice versa. So I tried to look at these in good faith, approach it with clean slate, just try to understand why things were done the way they were, instead of automatically coming at it in a stance of defensiveness of the library. So a lot of times, for example, it might be something as simple as like budgetary things that were done because of the way the city's accounting software was set up, or something totally benign like that. But over time, these things had kind of morphed at the library into something that people would complain about, like, oh, they're taking our fine money and we're not getting it, and all these things, and assuming sort of bad faith. But really, it was just everyone trying to work with what they had and within the system we had to work with. So, and I think just coming at things with a clean slate and trying to understand the why can help. And let's see. Oh, another thing that took time for me was figuring out how to be like a team player within our city without being a pushover. So for example, in Wisconsin, the library board, I know it's different in different states, probably other states work like this, but the library board has control over library funds. And the city really only has control over like how much money is appropriated, tax dollars are appropriated to the library. Um, so sometimes this line can be blurred a little because the library is a city department, but it also functions separately under the guidance under the purview of the library board. So there's a little push and pull there sometimes. At my library, the previous director had worked very hard to draw this hard boundary, make sure the city understood, and which was great. But she had maybe like burned a few bridges in this process of doing this. So when I came in, I benefited from that work she had done because the boundary was already there. But I was quite young, I was new, I was kind of seen as like nice and agreeable. And so I kind of, it was easy for like maybe that boundary to kind of get pushed back a little bit. So I also had to learn to stand my ground and say, yes, I want to work with you, collaborate with you, be part of the team, but no, you don't have control over certain things. That's under the library's board's purview. It's not personal. It's literally in our state laws.
And I'll just add before I go on that I had a similar experience to Christina in the city council not quite understanding what was their purview and what was the library board. So it doesn't necessarily have to be just a previous library director who was part of creating bad blood between the library and the municipality or county or tribe or whatever. It could also be simply a matter of education and letting people know, because people who are elected, especially in smaller towns, who are elected to be in charge of a municipality surely do not know library law. And so it's up to the library director to like lovingly and empathetically educate them and inform them. And that's how I approached my annual asks, was just as a reminder, you all approve this one line and the library board does everything else. So I'm going to go ahead and wrap up with strategic planning. We hear questions about this a lot. And full transparency, I am now an independent consultant working with libraries around the country. And the majority of the work that I do is helping them do strategic planning for the coming years. So clearly, I think strategic planning is important because I left my day job in order to help libraries do this. So again, talking about the pace of change, you need to do strategic planning at the pace that your library governance can move, and the library staff as well. And I just want to say it's okay to go slow. You don't have to create a strategic plan in the matter of an afternoon or a month or even 6 months. So as an example, this was quite some time ago, but ALA started their Libraries Transforming Communities fantastic program with the opportunity for 10 libraries around the country to send a 5-person cohort to learn with folks from the Harwood Institute. And I was lucky enough to have earned one of those spots. So myself and 4 of my compatriots went through that planning. We found out that we were going to have the opportunity to do that planning just as we were about to start strategic planning. So I got permission from the board to pull back on strategic planning. Let me learn about community engagement, which is what the grant opportunity taught us, so that we could take what I learned along with the other 4 people on my team and apply that to our strategic plan. So it took us a year to do our strategic plan because I wanted to go through the Harwood training first. Now, I knew from a previous career that getting community input into important things like libraries, things that affect people's everyday, it's important to ask the community stakeholders what they want. So I conducted a community-based planning and really just asked people what they wanted for a higher quality of life in general in Columbus. I didn't do interviews or focus groups around the library because we did a survey that was mostly about library stuff. And I believe firmly that in order to truly be transformative within your community, you need to know what the community wants in general for that higher quality of life. So you ask about what the community needs, what are the challenges within the community, and then it's up to you as the library leader to determine what role the library can play in helping deliver those services, programs, information, whatever it is that people are calling for. But you'll only know those things if you ask. So the first step is to just ask people what they want. Now, what you do with that information is totally up to you. You can, like I said, do a strategic plan in an afternoon with the library director and the board and have a nice agenda that walks you through a process to come up with your new strategic plan. You can do that on your own. You can hire a consultant to come in for a half a day for an affordable price to do that. You can ask a consultant to to play a role in only a portion of the strategic planning process. So with mine, I hired an outside source to run our community survey because I didn't at that time have very much experience with surveys and I needed a professional to do that for me. So we paid a small amount of money to one contractor to help us do that. And then we did a DIY for the rest of it, conducting our own interviews and focus groups and pulling the plan together ourselves. And alternately, you can 100% hire a consultant to help you with your planning process. But the important thing, if you haven't gotten it yet, is to go at the pace that your organization can stand up to. So if you're about to go into the summer reading program and you want to launch your strategic planning process, be aware that staff is going to be otherwise engaged for the coming 3 months. And so maybe it's important to start in the fall or something like that. So set yourself up for success by pulling in stakeholders and working with a timeline that works for them. So that's it for us for the top kind of 4 topics that we had been hearing questions on. Ramon, at this point, do we take questions or do we go into Amelia?
Yes, we'll go ahead and take questions. And thank you so much, Christina and Cindy, for that great presentation. We do have a few questions shared with me separately from the event. And if people want to continue submitting questions in the chat, we will also address them. But let's start with how do you assess the pace of change that the people you serve can bear? And there's a second part to this. What role do you find data can or should play in strategic planning and assessment for small public libraries?
Do you want me to start that one, Christina? Okay, so for assessing the rate of change, the reason I told the word book and train table story is because it was clear from those 2 examples that the community didn't handle change very well. And change was hard. And change is always hard, no matter who you are. Even if you're a change agent, change can be hard depending upon what the kind of change is. So I think you just need to spend probably your first year as a new director getting to know your staff and your board and your community and asking questions. How have things been in the past? How might things look like? Might they look like in the future? And just learn. Asking questions and listening, I think, is really important. And then just paying attention to like body language of staff. If you're proposing something new and exciting, just make sure that they can ride along with you as well. And on the strategic planning thing, I'll go straight into that. Can you tell me the exact question again, please, Ramon?
Sure. It is what role do you find data can or should play in strategic planning and assessment for small public libraries?
Yeah, I think data is super important. So there's 2 kinds of data. There's the quantitative data that you get as a result of something like a survey. So you get a whole lot of answers to a whole lot of questions that is all numbers driven. But then Harwood training taught me that qualitative data is equally, if not more important. And of course, I'm biased because I'm a community organizer. So I believe in the community having a stake in what their community institutions like libraries look like. So I think collecting that qualitative data through conversation with one-on-one interviews potentially, or focus groups or community conversations, town halls, whatever you want to call it, just asking intentional questions, and then listening and recording. And after you're done with that collection, looking for the themes that you're hearing come out of that. That's how you can make sure the library is serving the community's needs by asking them what they need.
Okay, awesome. Christina, any other thoughts on the role of data in strategic planning, specifically for small public libraries?
I think I pretty much agree with what Cindy said, and I would say when it comes to data, like make sure you there's so many resources out there. In Wisconsin, we have a really robust library systems that can provide us with a lot of data, and so I think if you just make sure when you're looking at data to like look into what like your sources are, and there might be more out there than you even realize that you have.
Yeah, actually, like census data is everything. So you need to know how your population's changing coming up, but also work with community partners. As an example, I got an incredible data source partnering with our local hospital because they bought data sets that were specific to health, but they could also apply to libraries. So just like be creative in your approach to data collection.
Awesome. Okay, we've got about 5 more minutes for questions. I want to ask those that are in the chat. Hi, when implementing or coordinating with libraries to work on strategic planning, did you ever run across any library staff or management unwilling to adjust to the change during the strategic planning process? If so, how did you work around or resolve this issue?
So I
Go ahead,
think that
Cindy.
one's me again. Yeah. The answer is heck yeah. I run across that with every library. I mean, change can't come naturally to everybody. There's just no way. So the way that I mean, I'm an outsider when I work with the library, but I think the way that the library director works with those staff members or with, say, those people in a governance role is to, one, give me a heads up that there's a little sticky situation there. But two, I think it's up to the library director to really work with people individually to find a way for them to participate. So if you're a kind of stick in the mud circulation staff person for whom change is very, very difficult, um, the director could work with that person to just say, okay, well, you don't have to think about the whole thing, but let's think about the circ desk. So how might things be a little more smooth, or what would you change if you had a magic wand? And just try and like hook them, give them one little morsel to kind of take ownership of. And from there, I think you can bring them along slowly, but you can bring them along.
Gradually leading them along. Uh, our last question is what advice do you have for someone who is leading from below? Our branch's manager is not interested in managing, and I have led the team for the last 2 years. I am not a manager.
I can speak to that one a little bit. And some of like my example uh, about customer service, like actually I'm kind of drawing from my experience in a much larger library too, where I was not a manager. Um, and I do think that can be really frustrating. I think for me, like the leading by example bit would be another great place to start. And talking to your manager, like, okay, well, how do you want me to deal with if there's like changes that need to be made, how do you want me to deal with it, seeing as I'm not necessarily a boss? Making sure that you're kind of clear there. I think, sorry, I'm gonna look at the question again. It's a really tricky position to be in, and I think just like being honest with your manager about change that you think needs to happen, and if you can create change from your position, kind of my guess is maybe you have like I don't know what size organization you work in. Maybe you only have one manager. Maybe your manager has a manager, but look into like what um, work at other with other people at your level, work with people in other departments, and try to see what you can get done. And maybe your manager doesn't need to be directly involved if their job is doing other things. I don't know, Cindy, if you have other
Yeah, I'll
ideas.
just add that I appreciate your frustration. Like Christina said, sorry, it's hard to be in that position. I just want to let you know that leading not from a leadership or a management position is really important for the rest of the staff as well. So if you become sort of a de facto leader of your compatriots at your level, that's not a bad thing. Sometimes you can be a liaison with upper management and help smooth things over below. And like Christina said, it's really important to make sure upper management kind of gives their blessing for you to play that role. In some cases, you're really not going to get that blessing because things are too dysfunctional. And I suspect that's probably where the person who asked the question is coming from. And my biggest advice is collect for yourself the many ways that you're leading from the level you're at and leverage those in the interview for the next job that you want.
Absolutely. And maybe that's a question that the person asking and others who are having similar experiences can explore further with either of you by email or some other means. If you want to drop your contact info into the chat, that would be great. Otherwise, we definitely recommend that everybody find the book, Small Public Library Management, second edition, and see what other advice pertinent to their experiences is in there. Thanks again, Cindy and Christina. That was a wonderful presentation and a Q&A. And next up, we have Dr. Amelia Anderson, who is the author of Library Programming for Autistic Children and Teens, second edition. Welcome, Dr. Anderson.
Thank you so much. Just to confirm everyone can see my screen here, I'm going to just keep going, and if you can't, interrupt me and I'll fix it. So I'm Amelia Anderson, and this portion of the session is implementing successful and inclusive autism programming. There's a lot to be said here, and I'm going to try to say what I can in about 20 minutes and leave time for Q&A at the end. So please know that a lot of this is also in my book. I am also happy to kind of delve into areas where you guys want to go a little deeper. So get your questions ready for me as well. So today what I'm going to do is first just very briefly introductions, so you kind of have context of who I am and where I'm coming from, related to this subject. We'll do basics of autism and neurodiversity, and then kind of the two big pieces that I want to go through are questions you might want to ask yourself when starting or continuing an autism program at your library. And then we'll talk about best practices for story times and programs for kids. And yeah, today I'm going to talk mostly about kids, but please know and remember that autism is lifelong, and it's really important to have services and programs across the lifespan. So just be mindful of that as well. So quickly, introduction. Hi, I'm Amelia Anderson. This is a picture of my book through ALA Editions. This is the second edition, and I'm thankful for Barbara Clipper creating the first edition and bringing me on to do the second here. I used to be a public librarian. I worked in Central Florida, a couple different library systems as a branch librarian, as an outreach services librarian. Then I went back for my PhD, and now I'm an assistant professor in an MLIS program at USF. So I use identity first language. So you will hear me say autistic person, not a person with autism. I'm doing that intentionally, and I will explain a little bit more about language choices later. And I do identify as neurotypical. We'll talk about neurodiversity in just a moment, but I think it's really important to put that out there, to recognize my privilege in this area. And I identify as an ally, and I hope through the work that I do that I'm seen as such. So to start with, a couple definitions of autism. And I share these because I know we're all coming in with kind of different levels of knowledge and understanding about autism. So this kind of gives you a sense of how I make sense of autism, and kind of keeps us on a common footing here as we get started. So the first one is kind of the more medical definition. This is from the CDC. They describe autism as a developmental disability that can cause significant social, communication, and behavioral challenges. I don't love the word challenges. It's a little bit deficit-based, but there you go. That's their definition. The one I like a little better is here. It's from ASAN, which is the Autistic Self-Advocacy Network. They describe it as a developmental disability that affects how we experience the world around us. They say autistic people are an important part of the world. Autism is a normal part of life, and it makes us who we are. All right, lots of tiny text here. Please do not strain yourself trying to read it, but just know this is how you receive an autism diagnosis, essentially. And please know also a lot of autistic people are undiagnosed. The diagnosis process can be lengthy, can be confusing, can be expensive. There are a lot of reasons why a person would not seek a diagnosis. But to meet diagnostic criteria for autism, this is what it is. So this again is from this is the DSM-5, which is an APA publication. And their criteria is that you must meet all of the three categories here under A. So you must meet persistent deficits in social communication and social interaction across multiple contexts. And you can kind of skim through that now if you would like. You also have to meet two of the four, and I realize now it starts at B. I'm sorry, that's a typo, but you have to meet two of the four subcategories here under B. So restricted repetitive patterns of behavior, interests, or activities. So again, you can kind of skim through and see some of these examples here. So again, everything from category A and then 2 of 4 from category B. So of course we should talk about prevalence. This is kind of a hot topic. Currently, the numbers are 1 in 31. And this is based on a CDC study of 8-year-olds in the United States. So they're saying 1 in 31 8-year-olds in the US are eligible for an autism diagnosis. Again, that's not saying that that's how many diagnosed children there are, but that would meet that criteria. And then you hear 8-year-olds and you think, okay, so that's children. But again, autism is lifelong. And so you might make the assumption correctly that those 8-year-olds will grow up and they will still be autistic. So 1 in 31 is our current number. It's touchy right now. Why the increase? So everything that we know in the research indicates that autism is not a public health crisis. It is not an epidemic. This is not something to be scared about. But instead, it's more likely that, I mean, we know autism has always been here. This is not a new thing. It's more likely this prevalence is increasing because we are more aware of it. We're more knowledgeable about it. Diagnostic criteria has expanded. And so for all of those reasons, we're just kind of more able to identify it. There are more conversations that could be had about this, but that's kind of the general understanding at this point. So autism exists. It manifests very differently in every person who is autistic. But some common characteristics are listed here. Again, these are not universal. Every person is different. But some things that you might identify in an autistic person, misunderstanding social norms, some communication, and again, kind of the social communication aspects might be a little bit different. Avoidance of eye contact, appearing not to look or listen to people. These are really important to know because just because a person's not looking at you doesn't mean they're not listening, doesn't mean they're not understanding and taking it all in. Focused interests in certain subjects, appreciation of being prepared and planning, and then the sensory sensitivities. So a lot of people kind of associate that with autism, and many autistic people do have sensory sensitivities, but not all. One more I'll point out is the stimming behavior. Stimming refers to self-stimulation. So things like hand flapping, That's a common one. Essentially, it's a behavior that helps a person kind of self-regulate. All right, so talking about autism as neurodiversity. Autism and neurodiversity are often kind of uh, maybe considered the same thing. Like you might use those terms interchangeably. They're not the same thing. Neurodiversity is more of like the umbrella topic, and autism is one of many neurodiversities. It could be ADHD or bipolar or Tourette's or autism. So an autistic person is neurodivergent, but a neurodivergent person isn't necessarily autistic. Neurodiversity, the movement is about differences in our brains, and it's just a diversity, and there's no right way of thinking. So, okay, all of that provides some context about autism and about how I frame it and how to think of it kind of in a library setting. So, what does that mean for your libraries? So, these are questions that you might consider when you are starting. It says starting, but really, if you're continuing, starting, editing, revising a program in your libraries. And this is something, as I mentioned, think about it across the age span. So I'm going to talk about kids today, but it's really important to have services and programs for all ages. So these are questions you might want to consider. I'm going to talk about three of them. Yeah, three of them specifically today. But again, these are all in the book, and you're welcome to peruse that at your leisure. So today I want to talk about marketing your programs, collaborating with other organizations, and also educating staff. Okay, so this one is a big one. Let me take a deep breath. Okay, how will you market your program? Really important to think about. And that is because if you develop a program for autistic people, you want it to be successful. I mean, if you develop a program for anybody, you want it to be successful. You want the group that you are targeting to find value in your program and come and enjoy it and reap all the benefits of the time that you have put in creating it, right? So if you market it incorrectly, members of that population might not feel welcome and might not come. And so it's really important that after you've put in the work to develop an inclusive program, that your outward-facing materials indicate that you are inclusive and welcoming and supportive of members of that community. So let's talk about language first. I mentioned using identity first language, so autistic rather than person first language, which would be with autism. This is a really touchy issue right now. When I was in grad school, we learned that you used person first language, so a person with autism. And that is done or was done to respectfully put the person before the diagnosis. And so that was kind of the considerate approach at the time. Since then, many surveys of autistic people have shown that the preference of autistic people is identity first language for a number of reasons, but maybe most importantly because they don't find any reason to be separate from autism, that it's part of who they are and part of what makes them special and interesting, and they are autistic. So no reason to separate the two. So I use identity first language, and autistic people value that. However, many parents still use person first, so they view their child not as autistic, but as having autism. It's still very common in K-12 education to use person first language, and in many professional journals, that still is kind of the case. So it is tricky. It's a tricky issue. When you're marketing your program, I would recommend using identity first language, but also listen to your community. And if you find that parents are upset about that, maybe it's an opportunity for education, Or maybe it's an opportunity for you to revise your language to kind of reflect what your community needs. There's also the option to use on the spectrum. This is kind of a more neutral third option. It's maybe not the preferred language, but it's also not offensive, typically. I'm sure some people will be offended, but it's kind of a more neutral option. So if you prefer, that is a way you could go with your program. You also want to be sure that you are avoiding ableist language. So this is kind of the more medicalized, like struggling with, challenges with, that kind of thing. You don't want to use language that is, yeah, that is ableist. So just be aware of that. You also want to avoid puzzle piece imagery. And that may be news or a surprise because we see puzzle pieces with autism all the time. But again, surveys of autistic people show that they find it to be pretty offensive, that they don't view themselves as a puzzle to be solved. They're not missing a piece. You know, all of these things with the puzzle piece can be pretty offensive. So just avoid it. If you do need to use an image, I recommend the neurodiversity symbol. That was a few slides back, which is kind of the infinity symbol. And also, you want to avoid using functioning labels. So some years back, Asperger's syndrome was removed as a diagnosis. And since that time, people have kind of tried to figure out how to label people with autism. You don't have to, just don't. Autistic people are autistic people. They exist on a spectrum just like we all do. Some have intellectual disability, some do not. There's never a good reason to use low functioning, high functioning labels. Just do not use them. So what do you say? What language can you use? Here's an example from Henrico County in Virginia. And they signal to attendees that the program has sensory activities, that it's a supportive program, it's adaptive, and that they will have an intervention professional. So you'll see here that they actually avoided the word autism. They didn't use identity first or person first language, and that is an option as well. If you're unsure of how to proceed here, that's one option that you can go. So this one, how will you collaborate for program development? And I really appreciate Cindy mentioning learning from your community before kind of starting something big. And that's true here too. In the autism community, there's a saying, nothing about us without us. This is adopted by ASAN as their official motto as well. And so I really recommend reaching out to autistic self-advocates in your community to determine what the actual needs are. You know, don't develop programming just to do it. That's maybe not appropriate. You know, you want to make sure that you're actually providing something that your community will value. And educating staff, it's important to think about all of the staff at your library. You know, I think we think about maybe the children's librarian or the person who's actually giving the program as needing to be, you know, autism knowledgeable, but it's really important that all members of your staff are, because if a family walks in your doors with their autistic child, maybe they're self-stimming, just, you know, demonstrating some behaviors that staff is not familiar with, you want to make sure that everyone on your staff that they will encounter is knowledgeable about autism and will be welcoming to those families and those patrons. I remember my old public library was like this long, narrow, like a bowling alley setup. So to walk all the way back to the program room, you have to pass a lot of staff members to get there. And so anyways, just lots of opportunities to create a more welcoming environment. So I'm going to try to wrap up here in just a couple minutes. I'll go through these pretty quickly. But again, these are all best practices for story times and programs, particularly with kids. But again, this can translate up through the age span as well. These are all listed in my book. And I'm going to just kind of quickly scroll through these. Some of them are a little bit more obvious than others, so I won't go into too much detail. But best practice number one, limit enrollment. Small groups make it easier to tailor and meet needs of participants and provide individual support as needed. Have assistance when possible. I know this is not always possible, but if you can, along with the parents that I'm hoping will stay for your programs, you also want to have a teen or adult assistant, again, just to help kind of tailor program needs. This one I'll talk a little bit more about. It's really important to prepare autistic participants. They really can benefit from that knowledge of what to expect. There's ways you can do that. If you are able, arrange for a library tour or open house before your library is actually open. Um, if you can't do that, maybe you could do a virtual tour, put it on your website. Um, and then this is an example of a social story from Deerfield Public Library. Social stories are just images with some text, kind of telling families, telling patrons what to expect. You could have this available on your website. You could give it to attendees if they register in advance. Just a great way for them to kind of manage expectations. Use visual supports when possible. Visual supports are just images used as a communication tool. This example is one of a visual schedule. You can have this up during your story time or program. You can simply have this printed and point to what comes next, or you can use things like Velcro to kind of put a little tab on what you're doing at that time. This also just helps participants keep track of what's coming up and manage transitions. So speaking of manage transitions, do this as you're able. So you can do this verbally. This is like reminding patrons, okay, we have 5 minutes to go in our program, and then we'll sing our goodbye song. Or you can do it having timers that they can see visually. And just providing information as you're able. You can also post this, in the schedule. You can say the first 10 minutes of the program, we will be doing stories. The second 10 minutes, we will be doing puppets, whatever it is. Control the environment as best as you possibly can. A lot of things you can't control, but if you can, try to reduce distracting noises, distracting sounds, remove fluorescent lighting if you can, identify if there's any drafts in the room. Just do what you can to create the kind of a safe and distraction-free program room. Provide designated seating, just giving children kind of a boundary within that big space is really helpful. This can be something as simple as carpet squares or even designating it with like a piece of tape. You want to have fidgets and sensory tools. These can be things that either help sensory seekers or eliminate sensory distractions. So things like noise canceling headphones would help eliminate distractions, and things like a fidget spinner would help with sensory stimulation. Have a box available. You can have this at your front desk for any patron, and then also bring it into the program room. A lot of kids will have their own. They know what works for them, but it's really helpful to have this for kids who do not. Create a quiet or sensory room. I know we've all probably seen, kind of elaborate sensory spaces. If you can't do that, that's fine. Think about what quiet space in your library you could use for patrons to kind of escape when they need to step away. Do you have an unused workroom? Do you have an unused office space? Just think about a place that you could keep unlocked that you could make patrons aware of that they can use if they need to take a little break. You want to incorporate repetition and routine. Do not think that repeating elements is boring. It is not. It helps kind of reduce anxiety in all children, and especially in autistic children. So within the program, you can repeat elements, but also across, like if you have a weekly program, use the same welcome song every time, use the same goodbye song every time. And then finally, you want to balance structure and flexibility. So yes, you want to provide all of these structured things, but be flexible, be ready to pivot and adapt, and know that, again, characteristics of autism manifest differently in every person. So just be prepared to kind of adjust your approach as needed. So it is 12 o'clock. I'm going to end there. And I appreciate your time and welcome your questions.
Thanks so much, Dr. Anderson. We have tons of questions and even more comments in the chat, which you may have been able to follow along with during your presentation. We'll start with the Q&A function. We may not be able to take all questions, but we'll take as many as we can. The first one is from Sarah Bess. It is, what advice would you give to adult librarians who want to make reliable information about autism accessible, knowing how hard it is to get a diagnosis, especially as a woman? And then I guess the second part to that would be, to what degree do you think it is gender?
Okay, start over again. So
what
I'm
advice
trying
would you give to adult librarians who want to make reliable information about autism accessible, knowing how hard it is to get a diagnosis, especially as a woman?
So making reliable information about autism accessible is that's the main.
That's the heart of the question.
Yeah. So yeah, it's a tricky time, right? It's a very tricky time. It's hard to know what to believe. We're getting interesting information from kind of top levels, right? And even some of the sources that I used to use and rely on myself, I don't find reliable anymore. I think I'm gonna go back to the idea of relying on self-advocate work for this. I really trust the ASAN, Autistic Self-Advocacy Network. And so I would start there. They have good publications. They have like, white papers and notes and things like that. I would just, at this point in time, I will point people there, I think. Again, I think you cannot go wrong collaborating with and learning from self-advocates. And one more little thing to put in there, do not assume every autistic person considers themselves a self-advocate. Don't make them do that work unless they want to. Okay.
And the same goes for anybody in a culture outside of the one
Yeah,
that you are operating in, and also people who are in the culture that you are in.
right.
Next question from Hannah Hodge. What are some differences between your edition of the book and Barbara Clipper's edition? I have the older edition. I'm wondering if I need the update. We think you do. And
Okay, you do. So the new edition, I think the biggest thing is that self-advocates. I've included a lot of work from self-advocates in the newer edition, talking about their experiences, both as library patrons and as librarians. There's some really interesting stuff in there from a children's librarian who is autistic, talking about his experiences both providing programming and kind of like being on the other side. As a child growing up in the library himself. That's there's a lot of other new things have been added, but that to me is kind of the big piece, and also more emphasis on language and kind of the neurodiversity movement, all of these things that have evolved.
Next question from Anonymous. Thanks for a great presentation, Dr. Anderson. I am curious what sparked your interest in focusing on autistic programming. Also, does your book include information on how to program for tweens and teens? It does. I am currently a school librarian serving grades 6 to 8. I have had our self-contained autistic class come over the past couple of years for story time and book checkout, but I'd like to start thinking of some new ideas for how to engage with them on a more regular basis. Thank you.
Yeah, thank you. To your question about how I got involved, it's not really that interesting. I just got involved in a grant when I was a doctoral student, and I just loved it. And I thought it would be, a 2-year commitment, and it's turned into my whole career. And I just love it. I love the work that I do, and I think I also hear so much positive feedback about kind of what I've done, and so it keeps me going. And yeah, I would love to hear about your plans for kind of moving forward with your autism classes as well.
Question from Shari. I am also a school librarian, grades 7 through 12. I'm looking for ways to make the space as inclusive as possible. Does your book cover physical spaces?
Yeah, a lot, quite a lot.
Awesome. Okay. Next question, also from Anonymous. How can library staff be encouraged in welcoming changes to programs that will include skills development for autistic patrons?
Yeah, I talk about that quite a bit actually in the book for teens. Um, in particular, there's a lot of information about kind of transitioning beyond high school. Yeah, developing skills is very important at all ages, but you may or may not be familiar with the idea of an IEP. It's an individualized education plan. Children in K-12 environments have that kind of helps them along their way after they graduate, that's gone. And so it's really important to help um, uh, older kids, teens, young adults focus on developing real life skills, and so they can be a little bit more independent and confident as they graduate. So yeah, there's information about that in the book as well.
I have a great question from Jonathan Griffith. My experience with talking about autism is that most people assume stemming is about regulating overstimulation, but libraries can be understimulating as well with beige colors, insistence on silence, and a uniform look. How are you looking at understimulating that's involved in library spaces and how to welcome autistic people from the entrance point?
Yeah, it's such a good question. I think so, especially in academic libraries, there's kind of this understanding, this unwritten policy that some spaces are quiet spaces and then some are like collaborative spaces. But it's not written down anywhere. It's like we just know that. But how are people supposed to know that if it's not like stated? So I'm a big fan of signage that clearly states like you can talk on this floor. Like I worked at one library that was like, oh yeah, it just gets quieter as you go up. But it was not written anywhere. Like nobody, we just knew that, right? But how are patrons supposed to know that if they are on floor two, they're welcome to like talk and, be kind of out there. So yeah, so I think it's really, for me, it's really important to have clear signage. And just not make assumptions that patrons know what we know, kind of.
Awesome. I have a question about whether you are aware of or have implemented any evidence-based therapy programs within libraries and what they look like when done properly. Done properly.
I have not. I think there might be some work there in school libraries, but I am kind of less interested in the therapy side and more interested in kind of the developing an inclusive environment for kind of universal access.
Awesome. How do you engage with parents who consider themselves allies but use language like challenges and some of the other terms that you mentioned early in your presentation that are not necessarily indicative of allyship, but they feel that they are?
Yeah.
How do you navigate that?
Well, yeah, language is tricky because I if they are acting like an ally, I would not try to correct their language. You know what I mean? Like if they are doing what's best for their child, but saying that he's struggling, is that really something that needs to be kind of corrected, or is it more of just using that language yourself and seeing if maybe they'll mirror it, adopt it, kind of understand why you're using the language you do? I think there are opportunities for education, while also knowing that like parents of autistic kids might be having, a rough go of it. It might be a hard day for them, and maybe it was hard getting out the door that day, and the kid doesn't want to be there, or who knows what they're going through. And so be empathetic to that parent as well. Yeah.
Wonderful. Well, two more questions. One, do you recommend having age restrictions and recommendations for story times and programs?
Yeah, I do. I think it's important to have people of similar age. I think there's a lot of research that shows that neurotypical peers can benefit a lot from being around autistic kids, and autistic kids can benefit a lot from being around those peers. So I think kind of creating that age group of peers is important. But again, I think it's really important to have those opportunities for all ages. So if you see that like an older person wants to sit in on that story time, well, maybe they just need a program that is appropriate for that age group.
Lastly, Autism Acceptance Month is coming up in April. Is there something that you think all libraries can do or should consider doing, regardless of what their budget is, regardless of how many staff they have, come that month or year round to advance in this area.
Yeah, and I've published about this as well. Like, I'm very excited that you asked that. The fact that you're using the acceptance language is really important just to start with. And I see, so Jonathan has a comment here about maybe we can have proper support for autistic adults as well. And that plays very nicely into what I'm about to say. I have analyzed a lot of programs that public libraries have done, and they are doing a great job of inclusive programs for kids. And they're forgetting about adults. And so I think it's really important to not just have programs about autistic adults, but have programs for autistic adults. So like what I've seen is that like, oh, maybe they'll show a documentary about autism for adults to come and see. And like, that's great. You're educating the community about autism. But what about those autistic adults? Like, how are we building their community? Like, how are we helping them to kind of have that support and that group, and what can the library do there? So I would look at supports for all ages, and again use that language that indicates that you're welcoming and inclusive.
Awesome, easily actionable advice. Well, thanks again, Dr. Anderson. A wonderful closing presentation. If you are interested in buying Dr. Anderson's book or the books by Cindy Fesemyer and Christina Jones, you can visit ALA's store at ala.org for copies. They are both available for order there now. Meanwhile, I want to again thank all the presenters and the audience for coming today. Let you know that the recording for this event should be on the Maine American Library Association YouTube page later today, certainly tomorrow at the latest. And if you like this kind of programming, definitely register for the ALA's upcoming Recharging in Challenging Times conference. That will be in just a couple short weeks in February. Consider going to the PLA conference in April, early in April, and then also the ALA annual conference in Chicago, which is in late June. Thanks again, everybody. We will also announce other programming from Edition soon, and we hope to see and hear from you all there with your always great questions. Thanks all.